Alaikum wa rahmatullahi wa barakatuh. Welcome to Sasa Media. Today we have a special guest, Dr. Shafi'i. Dr. Shafi'i, welcome to the show.
Thank you.
Today our topic is preventive health. As the name suggests, preventive. There's a lot of diseases that are preventive, but unfortunately are still headache to our community, such as chickenpox, measles, mumps, and so on. Doctor, what can you tell us about preventive health?
So there's a lot of things that can be done to prevent health, and we can take it one step at a time by looking at some diseases that can be prevented. So the first thing is, it starts with our children, and some of these conditions you mentioned, measles, chickenpox, these are conditions that can happen once in everybody's lifetime, but could be very, very severe when they occur. But the good thing is they can be prevented with vaccination.
Okay, so if they can be prevented with like simple steps like you suggest, like you said, vaccination, then why do you think that it's not happening? Why is that still an issue within our community?
The biggest issue is trust that the vaccine is going to work, but also problems associated with the vaccination has been one of the main drivers of hesitancy to vaccinate. And there were studies that were later proven to be false that showed a link between a vaccine for measles and autism, but later on that was shown to be false, and that study was retracted or taken out of circulation because the data was not accurate.
So I am a parent with a young children, right? Alhamdulillah. So what is the best thing that I can do for my children, for them to get the best health as possible as they can?
The best thing you can do is to prevent a problem before it happens. Okay. And so right now what we're seeing is the rate of vaccination for measles declined since 2008 in the Somali community, and also in other communities too. There has been some hesitancy with vaccination overall. And we're seeing a resurgence or increase in the diseases that were previously prevented. And so the best thing you can do is to prevent the problem before it happens.
Okay, so as you're aware of, being a parent, every year or every so often we go for a regular checkup. Is that something that we're supposed to be consulting with our primary care as well?
Absolutely. That's the best time to ask your questions about anything regarding your health. That's the best time to ask questions about specific preventive health measures like vaccinations, blood tests, whatever it is that's needed. That's the opportunity to talk with your healthcare provider and ask your questions. Because sometimes there are recommendations that are specific to a single person that might not apply to everybody. So when you go for your regular checkups, that's your opportunity to ask your questions.
Absolutely. Now that, alhamdulillah, Ramadan is about to end and Eid is around the corner, and Eid is about family, it's about community, and we're going to be doing a large gathering. Mm-hmm. So then what would you advise our viewers and our parents, people in our community, to steps that they can take to make sure then they're protecting themselves, but they're also protecting the community at large?
Yeah, and this is a good time to celebrate. Alhamdulillah, Ramadan is almost is over. May Allah accept it from us. But even with this joyous occasion, you have to make sure that you're taking care of yourself, you're taking care of other people. If you're sick, make sure you're taking preventive measures, washing your hands, staying away from other people as much as you can. If you know for sure you're sick,
wear a mask as well.
Wear a mask. At least it helps to prevent droplets from spreading to other people. So if it's not even 100% effective, if it can minimize the risk that other people are going to get sick, wear it. We're not saying everyone come in there wear a mask. I know that was the recommendation a few years ago, but if you are sick and you're coughing, you're sneezing, if you can cover your face and mouth, that will at least help to prevent other people from getting sick from you. So that's one thing that you can do. If you have a immune system that's low, if you're prone to getting sick, if you have a lot of health conditions and you want to protect yourself, and you don't trust that everyone who's sick is not going to show up or cover themselves, then you can wear a mask yourself, and not the cloth mask, but wear an N95.
Oh, Jazakallah khair, doctor. Again, the biggest message overall is please make sure then you're up to date with your vaccination. You're consulting with your primary doctor, things that affect you and that can also affect your family as well. And again, again with the preventive health, that's the name suggests, it's preventable if everybody does what they're supposed to do. Dr. Jazakallah khair. Hopefully we can do this more often. You and I can, consult about things that are important as far as health-wise for our community and the steps that the community can take at large.
Thank you, Yahya. Appreciate your time.
With Jazakallah khair.